Very quickly, I want to talk about the differences between MLS laser technology, radial shockwave technology, and high-intensity shockwave technology. There should be absolutely no confusion when it comes to the differences between ESWT or radial and shockwave, high-intensity shockwave technology and cold laser technology, especially the cold laser that we use, delivered by the M7 robotic laser at our MLS laser centers in St. Louis. The laser is anti-inflammatory and helps heal tissue without causing any shock or disruption to the tissues. It stimulates ATP production through the cellular membrane, which allows cells to heal. It's driven into the tissue up to 4 to 5 centimeters deep, utilizing a locked system of lasers, which is the newest, basically the best way to use laser technology. The 905 nanometer laser is pulsed, and it has an incredible ability to create ATP and heal tissue. And the 808 nanometer laser is essentially great at relieving inflammation. If you've got an injury or you have a chronic problem, be it hip, knee, back, shoulder, etc., reach out to the MLS laser centers of St. Louis. But back to radial shockwave. Radial shockwave uses a therapy handle, and it hasn't changed much in 20 years. If you look at the newer machines, they look bigger. They're definitely more, there's more technology in them. For the most part, you're going to see a handpiece, and you're going to feel energy going into your body. Radial, if I turn this on and I hit the foot pedal, it sounds like almost like a chiropractic activator. And at its lowest settings, it's kind of like that. But at its higher settings, it sounds like a pile driver. And essentially what it's doing is it's sending shock waves into a particular body part. These are high vibration, but they're not like the vibratory mechanisms that are seen on these massage guns. This is more focused, and these energy waves, because they're more focused, work well. So that is radial shockwave. It's a modality that can work very well. It creates a certain amount of inflammation as it's driven into the body, and then people heal from this, and the goal is to disperse inflamed tissues, fibrotic tissues, calcified tissues, and help possibly other medications or other forms of healing take effect as a result of this. Now, the difference between this and high-intensity shockwave is worth talking about, because many patients come into my office who've received radial shockwave and are convinced that they've received ESWT. I tried that, they'll say it didn't work. Some of them will actually say they tried high-intensity shockwave and it didn't work. Well, high-intensity shockwave is a very focused shockwave that is most of the time delivered under anesthesia. It's either a local anesthetic, usually a local anesthetic block. And that allows for the patient to be comfortable as extremely high-intensity shockwaves are fired into the tissues. The problem that I'm running into is that many patients will come in from chiropractic institutions that have purchased possibly originally the radial shockwave, saw that there was success, and then the same company or possibly a different company sold them a high intensity machine, and they did not have the license to numb somebody up so that they could effectively use the high intensity machine. And for that reason, they were only able to give shockwaves to a certain tolerance. Otherwise, the patient would just be in too much pain. Another negative is the patients that undergo high-intensity shockwave for, say, tennis elbow or shoulder problems or whatever, they just can't tolerate the intensity of these shockwaves without anesthetic. And so they come into my office thinking that they've actually had a real treatment utilizing high-intensity shockwave, and in fact they haven't, and I have to educate them and explain to them that they might have had radial, they might have actually had ESWT, but if they haven't had high-intensity ESWT with a local anesthetic block delivered in multiple thousands of shockwaves to fully cavitate the tissue and prepare it for, say, a PRP injection, then they're really not going through a program that is designed to maximally utilize the equipment that was used to try this on them. So if you know that, my objective for this video is complete. If you want to see how a 25-year experience with high-intensity shockwave is delivered now And the remarkable thing is very few changes have been made. Once we figured it out, we really figured it out for Achilles tendonitis and plantar fasciitis in my case, but all over the body. This has been figured out in Europe. Then go to the video below in the description, which links you to a review of an 11-year-old video that I did, again, 11 years ago, so it's completely outdated in terms of what the video looks like. But the key point that I'm going to make is that the information still holds up. And anytime you see a doctor and he can tell you or she can tell you, I've been doing the same thing or same procedure for 25 years and my results can speak for themselves based on modern reviews or patient success stories, what have you, that is a good thing. This is Dr. Michael Horwitz bringing you another episode of Podiatry Help Desk. Have a great day. Please like and subscribe.